right? And so I didn't grow up playing games. And so, but as an educator and a teacher, you know, paying attention to, I think, technology and what's going on in society, there's a lot of gaps in the way we teach and the effectiveness of it. So when I became more aware of VR and what its capabilities were, I thought it was a unique approach, a contemporary approach that could maybe bridge a gap that would allow for improved learning and really like memorable learning. So the immersiveness of it, I think, how do you lock in that into memory? And I figured these experiences might do that. You know, in traditional training where we do like a plastic mannequin and we do a neonatal resuscitation program, if I try and think about the courses I've taken, I have a hard time remembering any of those courses, like the people, the surrounding. But if I think of like a ride that I did at Disney World, like I can remember parts of it, or I can remember a movie. I can absolutely remember like real live resuscitations I was at. And so when I did VR, I would remember it, and it affected me in a very different way. And so, you know, when I reached out to John, one of the things I was excited about was his passion towards education and teaching. And it was this recognition of like, this approach might allow the learning you're doing in that environment to be more memorable. And then in a real life situation, things come back to you or they become more natural versus I think some of the traditional training doesn't always do that. And so I'm not saying this is a one size fits all, but it is a unique way to try and address some of the current educational gaps. You know, one of the things I thought was really important was to try and really have the right detail. I think one of the challenges with current sim is it's very evident you have a plastic baby in front of you, and and sometimes people I think get stuck on what's not real. The mind is like very aware of that and doesn't allow them then to kind of like move on and really absorb the learning experience. And so what we wanted to do with VR was have that environment when you look around look very real. And we had this device that could take really capture the whole environment, and then we can mimic that in a virtual. We can make that environment virtually, and so it's trying to really capture what's real and have it mimicked in high definition in a virtual environment to allow someone to actually their brain thinks it's real. It's kind of like if you've done VR sometimes and you're afraid of heights or something, some of the scenarios you'll be in where you're up on a building or a mountain, you literally are like trying to grab for the wall because you think you're going to fall. And so your mind has been, I guess, tricked or convinced. And so that's important in order to kind of, I think, that memory piece I was talking about, I feel like that allows for better learning, and then it just it doesn't feel as artificial.
So the scan really enabled our team to go in and make that much more realistic. So here you're seeing a comparison. The photo on the left of taken from that scan, and then on the right is the actual virtual reality environment.
It's you can have 30 people running around, and so there's tons of conversations going on, lots of noise. That's background alarms going off. If you don't have that built in either, there's something missing. So you have to have the question is, what's that threshold? Like you need to have enough of that, I think, for your mind to say like, okay, this feels like the real thing. And if you don't, then you're focused on like what's not there almost. With resuscitation, there's this technique called Mr. Soap of. It's how do you breathe for the baby properly if the baby's not breathing well. So you can adjust the mask, you can reposition the airway, you can suction the mouth, you can open the airway, you can increase the pressure, or you can do an alternative airway. And so for a learner, just kind of walking through that, the focus isn't so much on like, oh, I want to make sure the baby's everything feels right in my hands. It's more so like, do you know the process? Why are you doing that? And with each step, there can be some auditory, visual cues, but there can be like, as an instructor, opportunity for feedback or dialogue. So much of what VR could do would be to touch on conversations or more dialogue within medicine. How do you counsel someone, or how do you counsel a grieving parent whose child's dying? How do you do a prenatal consult for a family who just found out their baby has a heart defect that's going to require multiple surgeries. The reality is with intubation, you need to do about 80 to 100 of them before you get good, before you master it. And I kind of look at it like if I'm learning how to play the piano and I'm a new learner and there's an expert who's teaching me and I watch them do Mozart's Concerto number 27, and then I'm supposed to play it in front of an audience and then teach someone. It's like, well, that would be ridiculous. I wouldn't be able to do it. I'd make mistakes. But in medicine, we kind of do that, like, here, go have this difficult conversation with his family because you watched me do it once. And there's so much nuance and detail around that and so much complexity that I think virtually you can practice in that environment without the risk of actually harming a human being, like with a procedure or with a conversation that went really bad that you would say, whoa, like, let's coach you through that. Let's do that differently. And like when you talked about having an actor on the other end in a virtual environment, maybe that's an actor who's had real life experience with something that could say, hey, I did lose a child. And let me give you some advice on this, and then help the learner so that in real life, when they actually have to do it, they're more comfortable and it goes better.
Mm.
We created this, a baby who was a preterm baby. So this would be a baby close to around 30 weeks gestation potentially. We didn't want to do too extreme. And we also didn't want to necessarily do a term baby because we wanted a baby that would be a common baby that would need some help with breathing at the time of delivery. And so we have a baby, and this baby, the head can move, the vocal cords move, the baby can breathe. We spent a lot of time on the design of it to get the body to look right. The setting would be the baby was already born and on the table. You come in and you're going to hear the baby grunting or having difficulty with breathing. So as a learner, you need to recognize, oh, this baby's in some distress. And you could get some information. You can ask someone and say, hey, what's going on? And they could give you some of the story. And then you'd want to walk through, how are you going to address this baby's airway to help them to breathe better? How do you troubleshoot that? Do you do the steps that we are hoping you're going to do? And if not, let's talk about that. We can learn from that. And then we can, as the instructor, I can modify things to try and challenge the learner if I need to, or guide them. So some of these babies we take care of literally are like, they weigh as much as like a can of Coke. So they're under a pound.
Wow.
So it's tiny. Why would you want to practice some things virtually? Well, because when you have to handle this baby in real life, there's a certain way to do it that's going to make a difference for how well they're going to do. And you want to be able to practice that. Yeah, I think, one advantage of a virtual environment could be just to orientate someone to what things are going to look like. In medicine, so many times in my career, you just get thrown in this new environment that you're clueless to. And it's like, you're just supposed to figure it out. And that can be, we do it, but it's not a pleasant feeling. I think it also, we could make things much more user-friendly for anyone kind of in a new environment, and probably make things safer and a better experience if we were to potentially let them virtually step into it, walk them through it, like some of the equipment, some of the things, if you're doing surgery, whatever that might be, where, and that the beauty of that is it's, you could do it kind of anytime and anywhere. It's good that you're a little stressed, because when you go to a real delivery and you need to help a baby breathe, even though I've done this a long time, you still get, your own heart rate goes up because you need to help this baby. And if you don't do it, that can lead to a worse outcome for them, or in some situations, like if you don't get the intubation, they could die. So there's a lot on the line. And so being able to practice that and get comfortable with the sequence, in real time, that could translate into like at least a comfort level with that component of it. So what we did is, we picked a scenario that was very common. So this would be applicable to anyone really that would go to a resuscitation. Now, you could make these things much more nuanced depending on what your needs were, or if you had an expert that said, okay, I want to challenge this person, you could make this a more complicated scenario as well. The way these things often pan out, these aren't often this like scheduled delivery. This is often an unexpected, you come in, it's like, we need to deliver now. Some of these are urgent sections or crash sections. And so you get a bewildered parent who's often brought in, they have, they get on the head cover and a mask and a gown, if you will, and then they sit in that chair, and usually a nurse or someone will go up and I'll come up and talk to them and say, hey, and just, you're going to give them a little bit of information about what's going on. Then they're going to get led into the room where the C-section is often and be with the mom, or they're going to go up to the warmer then while we're resuscitating the baby. So the parent, someone needs to keep them informed and talk with them. So you want to simulate. I mean, you could imagine if you had a really good actor, the person could be stressed out or however they may be. Maybe they don't even speak English. So all these challenges you could have with like different scenarios that are very real, but that you want to go well. So have them go well in virtual reality so that when it is real, you have a good conversation, a delicate, important conversation, and communicate in a good way. So this is where we could, you could say, okay, we're going to sim this part, and you got an actor and the dad's stressed out and he's worried, or the baby's not doing well and he's worried. So how do you talk him through that? Or what if the baby dies? Like, how do you handle that? Like, you can imagine if you're a trainee and you've never experienced that, that could be really traumatic for the the health provider as well, not let alone the parent. This is just one piece of the story, right? So if you had the family who came in for prenatal counseling and you talk to them then, and then maybe you go do your pre-delivery consult, and then you have this scenario, and then you have the discussions afterwards, and then you have them go up to the NICU, and then you have tough discussions up there, or you have to, so this is, and then what about when they're discharged home, like, and they have follow-up. So you could imagine, like, with medicine, if you kind of pop in at any time, there's all these opportunities to say, well, what would the learning experience be right now? And I think this is also a really great way to think about diversity, equity, and inclusion, and some of the the biases and the problems we have within medicine. Why not address that in virtual world and help people get educated and trained and aware so that we do better in the real world? And so I think these are environments that are safer, where if you have the right actors who could say, like, okay, I come from a different background and I've had these life experiences and I don't trust the hospital, and I'm going to play my role. And then, we'd have a scenario, and then how do we conduct ourselves in those environments, and what kind of opportunities are there for learning? And I think that's where virtual reality right now could be a really powerful tool to practice some of this stuff that is really important and absolutely affects a person's experience in the hospital. Yeah, and I think you could sim that as well. I mean, I've had scenarios, they sound horrible, but like literally I broke rounds to go into a room where a baby was dying and pronounce the baby dead, comfort the family, spend time, and then jump right back into rounds, which just seems crazy. But that's the reality of the job, unfortunately. Or, I've been in a room where a baby died and then a brand new family is getting admitted to the NICU. So you have to go over and greet and welcome them. And these juxtapositions, they seem almost surreal, because it's like, well, gosh, wouldn't you want more time to kind of think about that and decompress or spend? And sometimes you don't have that, unfortunately. So I do think you can make that a simulation as well, where like you time limit it and you have to go on, and then you could review it and talk about, well, what were you frustrated about, or what, how could you have done that differently, or what would you do in that situation, and work through some of those things virtually that might help you real time. Hopefully this gave folks some insight into what's possible. There's a lot more we can do, obviously, and getting some of the kinks out just takes time, but there's a lot of opportunity here. And I do feel like this is one of the new frontiers of medical training and education, and will continue to grow. So it's cool to be a part of it.